legislation is out there, what would you propose? What's the fix as it relates to Medicaid?
Medicaid, I just feel like we can't have our roles. The thing is, they're going to naturally grow every year as our state population increases. We don't need to increase the threshold up to what the Affordable Health Care Act says just because for spending. If we grow it that fast, we're not going to be able to sustain it, especially if those federal funds, like we're supposed to end up at 90%. A lot of us don't believe that that's realistic. I mean, you can just turn on the news right now and hear the fiscal cliff talks. It seems like funding at the federal level is it's in an uncertain position right now. So relying on federal funds that may or may not be there seems like an unwise position to take.
Is there a middle ground then, or do you just stay where we are?
Personally, I'd like to stay where we are, but I feel like the governor did a very good job on the exchanges issue. I think he did his homework. I think it was very clear, or it is very clear, that he was trying to do what was best for the state. So I'm certainly willing to talk to him. It's not something that, you know, I'm definitely going to go 100 miles an hour no matter what the administration says. I think it's very important that we listen to him. I think like I said, he did a great job with the exchanges. I agree with his ultimate conclusion. I agree with his rationale. He thought that after he went through those 800 pages that he got from the federal government, that there wasn't a whole lot of evidence that we had more control at the state level. I feel like we can't afford to expand Medicaid. I know the hospitals, I think that they will absolutely be hurt by that, and we need to be very mindful of that. When you mention middle grounds, we do have to keep in mind there's a lot of jobs that could be at stake on that. I think we have to be very mindful when we're having these discussions about that. So that, like you said, is going to take a whole lot of time. I don't think that we expand it. That just seems to be, that's just me talking to a lot of other members, and you could get 69 other members in our caucus. You could get 28 Democrats and one independent in here who would have a different opinion. But I don't see other members, you know, stressing the need to expand it. We saw what kind of battle it was when Governor Bredesen had to remove folks from the rolls, and that's just extremely difficult. I really don't want to put our state in that type of position again. So I feel like from a fiscal responsibility perspective, that's where we have to be. Me personally, my wife's an optometrist. My district is Williamson County, which is known as a healthcare mecca. So there's a lot of people in my district who are extremely concerned about it. I'm a small business attorney. A lot of my clients have a lot to do with healthcare. So I feel like I understand the issue.